Happy New Year to all of you. I hope you all had an opportunity to relax and to recharge over the holidays. 2020 was certainly an eventful year, and I think all of us needed the break. But it's good to be back, and I think 2021 is going to be an amazing year for us at NeoMed. I do want to take a moment to recognize Dr. Haruta. Received notice this morning, in fact, that Dr. Haruta received an Ohio Department of Mental Health and Addiction Services grant in partnership with Coleman Professional Services on the project Cognitive Remediation and Consultative Training. Just another one of the great grant opportunities Dr. Haruta has had over the course of this last year. And so congratulations once again. And I also want to recognize our police department, our operations team, and our custodial crew for continuing to provide outstanding service to the university over the holidays. While many were away and enjoying the holiday break, we continued to be staffed over that time to ensure the safety, the security, the maintenance, and the cleanliness of our campus. And so not everybody was off during that period of time. And we certainly need to thank those who continued to work and look after the campus for us while many were away. I did have a chance to come in and visit over the holidays and meet with some of the custodial staff and see that they were doing additional cleaning, help ensuring decontamination of our work areas during this continuing and ongoing pandemic. So thank you very much to that amazing team for all the work that they do for us. We are now ready to phase back in to return to campus for our students and to return to work for our employees. As we messaged prior to the start of the holiday period, this is a phased in opportunity where our employees are continuing to de-densify based on the expectations and needs of their supervisors under the direction of the vice presidents that they fall under. So this will be done in a way that de-densifies the campus over the course of the next 2 weeks as we eventually phase back into where we were prior to Thanksgiving on January 18th. And this will be handled, as I said, independently based on the needs of the university and the needs of members coming in to be able to complete their work duties over the course of that period of time. For our students, we expect that they're all back on campus. They've had a great opportunity to enjoy a lengthy break as well as virtual education prior to the beginning of the holidays. And we've brought them back now, officially today, to do more virtual education for 2 weeks until the 18th when we return to our hybrid model of education that worked so well for us during the last semester. The intent of this 2-week period of time is to come back to campus from traveling to ensure that we have a pseudo quarantine period of time for the students to be back on campus, be back in their normal surroundings, and to help to reduce the risk of COVID infections. We are asking everyone to please follow all the protocols for safety as we have done in the past. And we are asking those who are on campus and can be available to take advantage of the free COVID-19 testing that we're doing. Although we're not mandating the asymptomatic testing, we are highly encouraging it as a way to keep our campus community safe. So our COVID-19 task force, led by Dr. Joe Zarconi, has worked with the Ohio National Guard and arranged for symptomatic and asymptomatic COVID-19 testing on campus tomorrow from 10 a.m. until 2 p.m. And we ask all of you that possibly can to please come in and undergo testing to help us monitor the campus safety status. Over the past 3 weeks, we have had 11 new COVID cases. Those have all been in NeoMed members, 4 employees and 7 students. The campus was essentially closed, so we did not have any exposures on campus. And those positive cases were all in students and employees who were off campus, either in or out of state. And they are all being managed appropriately by the Department of Health and being followed by our COVID-19 task force to ensure that they are in isolation and appropriate contact tracing is being completed. We have also continued to push Lean Six Sigma as the way we're doing business at the university. It's a way to be more effective and efficient in what we do, for us to be able to reduce waste and reduce workload that's of unnecessary energy, so that what you're doing has more meaning and more impact. I want to thank all of you that have already participated in the Yellow Belt training. Encourage those of you who've completed Yellow Belt to now sign up and complete the more advanced level, which is Green Belt training. And for those of you who've not participated in Yellow Belt, to please sign up and participate in the programs that are running over the course of the next several months. Our January training program is already oversubscribed. However, there is still room in the February and March cohorts. We look forward to having you become aware and informed and engaged in Lean Six Sigma. This is a great opportunity for faculty and staff to build their careers and their resumes, as Lean Six Sigma is a recognized industry standard across the country and in many cases across the world on how to do business more effectively. So I encourage you to please sign up. And this is something that we will be highlighting over the course of the next years to come as we continue our journey to become a Lean Six Sigma institution. The COVID-19 vaccines are out, as many of you know, but they are not available to the general public yet. They are still being prioritized to elderly at risk, as well as healthcare providers. The Neomed Pharmacy is now an approved vaccine provider, and we are expecting to receive the COVID vaccine sometime over the next weeks to months. And when they are available, we will immediately let you know, so that our community can come in and get vaccinated against COVID-19, helping us to end this pandemic. So please stay tuned and we'll have more information available for you. We have a lot taking place on campus over the next months, to include our LCME site visit, the introduction of new master's degree programs in the College of Graduate Studies, enhanced diversity initiatives across the university and across the colleges, and the launch of our faculty and our staff development program, among many others. I expect 2021 is going to be a great year for Neomed. While we are still going to have to adapt to the pandemic, many times having to change the way we do business over really a short course of time, as we've had to do in the past, we're hoping that the main surges are going to be behind us in the course of the next 2 weeks, and that we'll be able to return to a state of relative normalcy. And then ideally, we're hoping that by the beginning of the fall semester for 2021, that we'll be back to business as usual prior to the pandemic. But that really is going to depend upon our ability to abide by safety protocols and policies, and to have a robust vaccine initiative in place to ensure that we can put an end to this problem now. And with that, I'm going to keep it short today and open it up to the community for questions. Michael?
Yes, the first question is, the COVID testing tomorrow open to families of employees?
COVID testing tomorrow is open to anybody. We have elected not to advertise it broadly through media as we've done in the past, because we want to give priority this time to the Neomed community. But you certainly can bring family members, friends, and people from the community who show up to get tested will be allowed to be tested. We're just really trying to make sure that we're having enough bandwidth to also test the majority of our internal community.
Has any consideration been given to providing COVID antibody testing to the members of our community?
Not at this time. It's not been recommended. We work closely with the Inter-University Council and the governor's office and have our COVID-19 task force working on this. Right now, that is not recommended. We are continuing to do asymptomatic testing. We don't really know what the meaning of antibody testing is at this time. Is there a difference between those who've been exposed and develop an immune response to the immune response that you received from the vaccine? There are many answers that still need to be figured out scientifically. So at this time, we are not pursuing that. And in general, most organizations are not doing that.
Any updates on vaccine availability for students, especially medicine and pharmacy students doing clinical rotations, since they are really acting as healthcare providers?
Yeah, this was a topic of discussion today in both the COVID-19 task force meeting as well as the executive management team. We're working with our healthcare providers to try and figure out how we can prioritize our students. I suspect that our hospital systems, once they've adequately vaccinated their internal workforce, are going to be not just pushing for us to do it, but I suspect they're going to be mandating it at some point because our students, while part of the healthcare delivery team, are not part of the official organizations, at least employees that they're responsible for. And I think they're going to see it as a patient safety issue. Much like when the pandemic first began, they were unsure of how to control the risk of students and high-risk patients. I suspect that they're going to tell us that it's going to be a mandate for our students to be vaccinated. So we're working diligently now to try and figure out how we can prioritize them. Currently, students in general are not a top priority when it comes to COVID-19 vaccinations. The governor's office has been working to determine what that prioritization level should be. However, healthcare students are different, and we are advocating for that and working hard to get the vaccine to make it available, like all vaccines for COVID-19, free, no cost to the students, but they are certainly a priority for us, as are our faculty. Our faculty essentially, I believe, should be considered frontline workers in a congregate facility. And so we need to make sure that our faculty, many of whom are in the high-risk categories because of the age that we are, and we need to make sure that we're prioritizing it for those two groups. So we will keep you up to date. It is on our minds. I just don't have an answer for these students yet.
If you're able to receive a COVID vaccine ahead of when it should be available at Neomed, should we report our receipt of vaccination to HR?
I think that would be ideal. We're still working through what the vaccine protocols are going to be, and we're doing that with guidance from the state. Right now, there's a big concern at the state level for the number of individuals who are not voluntarily opting in for the vaccine. If you followed Governor DeWine's reports, it was noted that about 60% of frontline workers in nursing homes, really high-risk patients, are opting out for the vaccine at this time. It's unclear why, because the vaccine has true science behind it. It's got a great safety record, and we are a health sciences university. I think we need to abide by the science that we teach and promote. So we're going to be pushing hard to get people to get vaccinated, and we're going to want to collect that information. Whether this becomes a mandatory vaccine or not is still being discussed. The interpretation right now is that it can be mandated, just like we mandated the flu vaccine, but we're working with the state and the IUC to determine what the best course of action is at this time across all of the universities.
There are no further questions at this time.
Well, thank you. If you do have the opportunity, I encourage you all to get the vaccine. I continue to do some small aspect of clinical care myself at the VA hospital, and the VA has informed me they would like me to be vaccinated, and I intend to get my vaccine on Thursday, and I encourage all of you to follow suit when they become available to you. So thank you. I appreciate your time, and I'm looking forward to a great year together. I really think that 2021 is going to be a really great year. And as much as 2020 was a difficult year, I think 2021 is going to be even that much better. So I look forward to working with all of you and a great year ahead. And thank you for spending time with me this morning.